The healer might come today. The healer might come and take. The healer might come and take away the pain. He might come and take it all away.
So I think for a lot of people when they see a dog, they think that's wonderful, that's cute and that's sweet. But actually therapy dogs and therapy animals have an incredible effect on our young people and on our children. So the issue we want to address is really around social isolation. It's also around children's attachment and their ability to seek services when they need. What we know in Wodonga, that 1 in 5 young people experience high levels of distress or psychological distress, which includes things like depression and anxiety. The government has recently told us as a result of COVID that it's probably more like 1 in 4 young people and potentially even higher than that. So what we're seeing with our vulnerable groups, and in fact with the whole of society, is people are more isolated than they ever have been before. They're isolated from school, they're isolated from their social groups. And at Junction we provide a lot of services, and what we know is that it's very hard for a young person to actually connect in sometimes with that service. Sometimes it's because they don't trust the individual necessarily yet who is providing the support. Sometimes they've had really traumatic experiences. In fact, most of the time they've had really traumatic experiences that prevent healthy relationships into the future. And so what we're wanting to do is have a dog, a therapy dog here, who helps to mend that relationship. So what we know, when that attachment is there, it then produces oxytocin, which is the love hormone, which is actually what we get from hugs and what we get from closeness. Now, a lot of these children have never experienced that or struggle to experience that in a safe environment. And so having a dog actually helps us to surpass all of that weeks and weeks of work developing the relationship and actually get right to the work that we need to do. That means for our counsellors that they can get straight to the heart of what they need to work on rather than having to wait those weeks. So the impact of having a therapy dog, we know, reduces stress, it reduces anxiety, it reduces depression. It also makes for a really positive work environment for our workers. But that was really well done. Totally fine. So if we're successful, the funds will actually be to purchase the dog in the first place. It will then cover all the training needs of the dog and the training needs of the staff. What we need to understand in this situation is the dog is a working dog, and therefore we actually need to make sure that everybody who's working with the dog, and including some of the clients, actually have a level of training. So the funds will also cover all of the setup costs, everything from vet bills, a new bed, toys, everything that we need to actually run the program into the future. What we know is that when there's a human-animal bond that happens, children are able to attach, and what attachment does, so positively attach, make a great relationship with that animal, and that can then go well past what a human relationship can be.